Lesson 11. Professional methods of stress reduction. Stress is one of the most important factors influencing the course of any mental illness, and in schizophrenia its role is even greater. In psychiatry, stress is not treated as a minor inconvenience of nerves, but as a real biological factor affecting brain function. Stress changes how the limbic system works, disrupts the balance of neurotransmitters, lowers the ability to think logically, and worsens the body's immunity. That is why in professional clinical models we do not talk about coping with stress, but about managing the stress load so that the nervous system, both of the person who is ill and of the caregiver, is not pushed beyond its biological limits. In schizophrenia, stress acts like a catalyst. It can speed up relapses, intensify disorganized thinking, trigger anxiety, disturb sleep, and provoke fearful states. Even small changes in the environment can trigger a reaction in the ill person that would be disproportionate in someone healthy. This follows from the different neurobiology of stress. In schizophrenia, the limbic system is more reactive, the prefrontal cortex functions less steadily, and the brain returns to balance more slowly. That is why one of the main goals of treatment, alongside pharmacology, is stress reduction on all possible levels. In this lesson we will focus on stress reduction methods that have solid scientific and clinical foundations. You will see how to reduce the overload of the nervous system by changing the environment, what possibilities modern pharmacology offers, and how the Buddhist tradition, in its practical, down-to-earth form, can support psychological balance. Stress will not disappear from your lives completely, but it can cease to be the fuel of the illness. And that is precisely the aim of this lesson. Environmental and home-based interventions. Most guides for caregivers talk only about how to create a calm environment for the person who is ill. That is important, but one-sided. From a clinical perspective, it is your environment, your space, your ability to recharge, and your place to breathe that has key importance for the stability of the care system. Chronic stress in caregivers is one of the main causes of burnout, depression, and anxiety disorders in this group, so environmental interventions must concern you in the first place. Caring for someone with a mental illness creates constant tension, readiness, vigilance, unpredictability, and no guarantee of peace. You can love the person you care for and at the same time need a space in which they are not present, a place where your body and nervous system can return to balance. In community psychiatry, this is considered a basic requirement for the caregiver's health, not an act of egoism. The most important element is creating a private, exclusive space for yourself. It can be a separate room, a corner of the living room, even an armchair by the window, a place where no one needs anything from you and the person who is ill has no access. In many families, caregivers do not allow themselves this separation because they feel they should be available all the time. Yet in psychiatry it is emphasized that a caregiver must have a zone of autonomy, otherwise emotional exhaustion develops quickly. This space is meant to give you sensory and psychological rest, as well as short moments in which you can relax without the pressure of having to monitor something. The second cornerstone is respite care, even if at first glance it seems unrealistic. WHO and NICE clearly state that a caregiver cannot be on duty 24/7 for many months. Such a load destroys both mental and physical health. Respite care does not have to mean a paid, professional service. It may be a family member, a friend, a neighbor, a local organization, a parish, or even short-term community support that gives you a few hours break. If you do not have such support, it has to be consciously organized by talking with other relatives, using available services, or, if necessary, contacting local social services. A caregiver who never gets a break is always moving towards collapse. Another essential need is setting clear household boundaries. In practice, this means you do not have to be available at every moment and at all times. The person who is ill may have their expectations or anxiety, but you cannot let this consume all your attention. Boundaries protect your nervous system. They may concern times of day, areas in the home, rules for conversation or physical contact. Community therapists often teach caregivers to set boundaries firmly but calmly, without emotional bargaining. Boundaries do not worsen the patient's condition, on the contrary, they stabilize the environment because the person who is ill knows what to expect. Very important, too, is sensory offloading, not only for the person with schizophrenia, but especially for you. A caregiver who lives in constant noise, chaos, and sensory overload reaches the threshold of exhaustion much faster. In practice, this may mean quietening your own space, using noise-cancelling headphones, limiting TV, keeping order in the places where you rest, and avoiding unnecessary intense stimulation in the evenings. Your brain needs calm at least several times a day to return to balance after contact with the illness of your loved one. You also cannot ignore the caregiver's need for social connection. Isolation is one of the biggest destroyers of mental health. That is why even brief contact with other people, once a week, is a form of therapeutic intervention. It may be talking to a friend, attending a support group, online contact, or short outings. This is not me time in a trivial sense, it is a key element in preventing depression and burnout. The final part of environmental interventions is structuring the day around your recovery, not only around caregiving duties. The person who is ill has their needs, but you also have the right to fixed moments of rest, a morning routine, time after meals, a short nap, a walk alone, a quiet coffee. Many caregivers give up these elements because they feel it is a luxury. In community psychiatry, however, they are treated as essential therapeutic tools, because without them the caregiver loses stability and then the entire care system collapses. Home-based care is therefore not about creating ideal conditions for the person who is ill at the cost of your own life. It is about creating a balance that protects you first of all, because without you there is no one to help the patient. The caregiver's environment is just as important as the patient's, and in practice, very often more important. Pharmacological methods. Pharmacological methods of stress reduction are not about sedating the person who is ill or the caregiver, but about taking some of the overload off the nervous system when the body and mind can no longer carry it. In psychiatry, stress is treated as a biological factor, not a psychological weakness, so in some situations medication is necessary, both for the patient and for the caregiver. Medical supervision is always essential, but as a caregiver you should know what options exist, how they work and what to expect. First, doctors reach for long-term anti-anxiety medications. These are mainly drugs from the SSRI and SNRI groups. They do not work immediately, but gradually lower the general level of tension and anxiety and stabilize the stress response. In people experiencing long-term overload, whether patients or caregivers, these medicines often act as a protective buffer that helps prevent further crises. Buspirone also belongs to this category. It is used in chronic anxiety and does not carry a risk of dependence. It is milder than benzodiazepines but much safer for long-term use. The second group are medications that regulate sleep. In psychiatry, sleep is considered the main regulator of the stress axis, so its disturbances require not only behavioral strategies but also medical intervention. Doctors often use hydroxin, trazodone, or mirtazapine. All three have a calming effect, reduce tension, and facilitate falling asleep. Melatonin also has its place here, especially when the problem is a disrupted circadian rhythm, which happens both in patients and in caregivers who are woken at night. It is worth remembering that stabilizing sleep lowers vulnerability to stress much more effectively than any on-the-spot remedy. In some cases, the psychiatrist also uses small doses of antipsychotic drugs with a sedating effect. This is not treating psychosis as such, but a way of reducing agitation, racing, or chaotic thoughts and irritability that increase under stress. Quetiapine in subtherapeutic doses is sometimes used precisely as a medication that stabilizes sleep patterns and reduces tension. For you as caregiver, this information matters. Sometimes doctors change the patient's medication not because psychotic symptoms are worse, but because stress has disrupted the neurochemical balance. The best-known group of anti-anxiety drugs are benzodiazepines. They act quickly and effectively. They reduce anxiety, calm and lower arousal. However, medicine approaches them very cautiously. They can lead to dependence, tolerance and, paradoxically, increased anxiety over time if they are used too long. For this reason, benzodiazepines are used almost exclusively as a short-term measure during acute panic attacks, total insomnia, or sudden crises. As a caregiver, you need to know one thing: these drugs can help, but they require strict medical control and are not a solution to everyday overload. There are also medicines that reduce the physical symptoms of stress, such as tremor, tachycardia, or bodily agitation. Most often these are beta blockers, used primarily for stress-related cardiovascular symptoms. They do not directly affect the psyche, but by reducing the body's reaction, they lower overall tension. They are used less frequently, but in selected situations their effect is very precise and effective. In some cases, the doctor may introduce mood stabilizers. This concerns situations where stress causes pronounced emotional instability, mood swings, irritability, impulsivity, or periods of low mood. Stabilizers such as lithium or valproate do not work on the spot, but in the longer term they protect the nervous system from reacting to stress in a violent and unpredictable way. In clinical practice they are used more often in patients, but sometimes also in caregivers, especially if overload has been ongoing for many months or years. The key is to treat pharmacology as one tool among others, not as a complete solution. Medication will not replace rest, social support, environmental change, or setting boundaries. It can, however, significantly lower the level of overload and create conditions in which the mind of the patient or the caregiver can begin to recover. From a medical standpoint, pharmacology is most effective when it is part of a broader stress reduction plan, not the only response to tension. Your role is not to choose the drugs, but to observe yourself and, if necessary, to tell a doctor about your own exhaustion. Caregivers also have the right to medical help. No less than the person who is ill. Buddhist methods. Buddhist practices, in their original, therapeutic form, are not spiritual decoration or just relaxation techniques. They are systematic methods of regulating the mind, particularly useful where stress exceeds the nervous system's biological capacity. Modern neuropsychology confirms that these techniques change activity in the amygdala, strengthen the prefrontal cortex, and improve parasympathetic nervous system functioning. That is why they are among the most effective tools for reducing stress, both for the patient and for you as caregiver. Unlike many Western relaxation methods, Buddhist practices do not aim to push stress away. They teach you to regulate your response before stress has time to create damage in the body and mind. 3 areas are most important: mindfulness, breathing, and reduction of distractions. Each of them can be used even in short, daily doses. Mindfulness, sati, observing without fighting. Mindfulness, in its original form, means noticing what is happening in the mind and body without reacting to it with fear, pressure, or automatic tension. It is not about the turning off thoughts or attaining inner peace, but about developing the ability not to be swept away by stress impulses. When you observe your state of mind instead of automatically identifying with it, the stress reaction becomes shorter and does not escalate into a spiral of tension. MRI studies show that regular mindfulness practice reduces activity in the amygdala, the fear center, and strengthens brain areas responsible for assessing situations and regulating emotions. These are exactly the areas that stress overloads the most. In people who practice, the ability gradually develops to step back from their own impulses. As a result, the person who is ill reacts less violently, and the caregiver returns to balance more quickly after confrontation, crisis, or sudden tension. An example of a practice: placing your attention in the breath and observing incoming tensions without immediate reaction. Even 5 minutes of this kind of practice changes how the nervous system functions. Conscious breathing, anapanasati, regulating the stress response through the body. In Buddhism, the breath is a tool, not a goal. The breath has a direct effect on the autonomic nervous system. When the exhalation is longer than the inhalation, the vagus nerve is activated and the nervous system shifts into parasympathetic, calming mode. This is why simple breathing techniques are often more effective than medication used on an as-needed basis. The most important elements are slowed breathing, especially a prolonged out-breath, breathing through the nose, not the mouth; diaphragmatic breathing, the belly rises on the in-breath; regularity, not intensity. For the caregiver, breath practice is a way to interrupt the overload spiral immediately. You can do it in the kitchen, in the bathroom, before sleep, in the middle of a crisis. For the person who is ill, it is a method of self-regulation that does not require intellectual effort. The breath works even when the mind is chaotic. In psychiatry, breathing techniques are classed as low-threshold interventions. They work quickly, are safe and effective, including in psychotic disorders, as long as they are used gently and without pressure. Reducing distractions, pratyahara in a secular sense. In the Buddhist tradition, there is the idea of withdrawal of the senses, reducing the amount of stimuli flooding the mind. In contemporary psychological language, this is called reducing sensory load. It is one of the most important tools in schizophrenia. The nervous system of a person who is ill is sensitive to noise, time pressure, constant notifications, a TV in the background, clutter, intense light. Your system, as a caregiver, becomes overloaded in much the same way. Reducing distractions means introducing periods of silence, switching off unnecessary screens, monotonous tidying and ordering of space, limiting conversations at moments of overload, creating a quiet zone free of stimuli. This method is crucial because it works preventively. Before stress explodes, it is already being lowered. Metta and Karu, stabilizing emotions through the mind stance. In the Buddhist tradition, working with emotions is based not on suppressing them, but on changing the way we relate to ourselves and others. The practices of metta, loving kindness, and Karu, compassion, are well researched in psychology as interventions that reduce social anxiety, aggressive reactions, and relational tension. In the caregiver, these practices reduce the automatic patterns of frustration and exhaustion. In the person who is ill, they lower suspiciousness, irritability, and interpersonal tension. They work like a shock absorber in the relationship, making communication easier and helping you get through difficult moments without conflict. Importantly, metta is not an affirmation, but an exercise in neuromodulation, widening perspective and relaxing the limbic system. Micro-tudong. In the monastic tradition, tudong means a long walking pilgrimage in which a person leaves the hustle and bustle behind and lets the natural rhythm of walking and the environment calm the mind. At home you are not able to undertake full tudongs, but you can bring in their miniature, everyday version, micro-tudongs, that is short evening walks combined with walking meditation. This is one of the most effective regulatory tools you can use when caring for someone with a mental disorder, and at the same time a tremendous support for your own mental health. Evening walks have a special effect. The body naturally lowers cortisol levels towards the end of the day, and calm movement at a slow pace deepens this effect. The nervous system shifts from doing mode into regeneration mode, and rhythmic walking acts as a natural stabilizer. Walking meditation does not require advanced skills. It is based on observing your steps, the rhythm of the breath and the sensations in the body. In practice, it looks like this. You walk slowly and consciously, while your attention gently rests on the feeling of the foot touching the ground. You do not have to control every second or silence your thoughts. The rhythm of the steps does most of the work for you. Micro-tudong is therapeutic on two levels. First, if the person who is ill walks with you, it helps them detach their attention from the flood of thoughts, fears, or agitation. Walking is a task simple enough to engage the body without burdening the mind. Thanks to this, fear and tension have nowhere to anchor. Second, and equally important, micro-tudong is a tool of recovery for you. After a whole day of being on guard, reacting and on duty, your nervous system needs a moment when nothing is required of you and you can simply walk, step by step, without thinking about responsibilities. Modern neuropsychological research shows that slow, rhythmic movement carried out for 10 to 20 minutes reduces activity of the sympathetic nervous system and lowers stress even more effectively than static meditation. This stems from the fact that walking is a natural human movement, and the repetitiveness of steps affects the brain like a soothing metronome. Walking meditation is therefore ideal for people who find it difficult to sit in silence, both for patients and for caregivers. Micro-tudong can take many forms. It can be a slow walk around the house, going up and down the street in the evening, a stroll in the garden, or a few laps around the block. You do not need monastic silence or perfect weather. The whole point lies in rhythm and awareness of movement. If the person who is ill is having a harder day, such an evening walk can reduce the risk of nighttime agitation. If you are the one who has had enough, micro-tudong can be your only moment of respite that allows you to get through the rest of the week without breaking down. It is also worth remembering that micro-tudongs strengthen the relationship. Walking side by side, you remain in silence. Mere presence, without the pressure to talk, creates a space of safety and calm. Sometimes it is precisely after such a walk that the person who is ill will say a sentence they were unable to say earlier. In silence and slowness, a channel of communication opens that does not exist in the noise of everyday life at home. In practice, evening micro-tudongs are one of the simplest and most effective tools for reducing stress. For the person who is ill, they stabilize, calm and discharge tension. For you, they are a substitute for a short tudong, a moment of breathing space, a time when you come back to yourself. It is a small, daily step towards greater balance. Evening ritual. Many psychiatric care homes use short rituals to end the day because a predictable, repetitive evening pattern has a powerful stabilizing effect. One idea may be to create a small shrine or altar. Lighting candles, incense and leading an evening puja has enormous therapeutic value, both for the person who is ill and for you. This is not a religious practice in the traditional sense, but a regulatory ritual that affects the nervous system, emotions, and the caregiver-patient relationship at the same time. You can adapt its symbolism to your own beliefs, because the religious system itself is of secondary importance here. The evening ritual introduces an element of sacredness into everyday life, a moment of quiet, pausing and jointly closing the day. Each of its elements has its own psychological function. Lit candles and dimmed lights lower arousal, because warm-colored light inhibits activation of the sympathetic nervous system. Quiet monk chants in the background act as a steady auditory stimulus that reduces tension and fills the space with calm, so that the brain does not react to every tiny outside sound. The scent of incense, if it is gentle, deepens the sense of the ritual's distinctness. It brings the body into regeneration mode, signaling that the day has ended and the time of rest is beginning. The first element of the ritual can be a short silence, a brief pause during which both you and the person who is ill signal to yourselves that you are moving into a different state, from doing mode into calming mode. After this comes Pankasila, the 5 precepts, spoken calmly and without a moralizing tone. In this context, they are not a religious obligation but a reminder of principles of balance and simplicity that help organize emotions after the day. Many people feel a sense of relief during Pankasila, as if the words restore the feeling that, despite chaos and difficulties, there are some simple, timeless frames that still apply. The next element may be a short conversation about one issue from the day. This is not analysis, therapy, or problem solving. On the contrary, it is about gently summing up one event in an atmosphere of acceptance and mutual respect. A conversation in this form teaches both sides to end the day without brooding, without tension, and without leaving emotional conflicts open. Psychologically, this is extremely important. The sense that the day has been symbolically closed lowers nighttime tension and reduces the risk of insomnia in both the patient and the caregiver. After the conversation comes a moment of gratitude, giving thanks for the day that has passed, for what was good, and sometimes even for what was difficult but has been overcome. In psychology, such a gesture is a form of reframing, transforming the narrative from overwhelming to constructive. For the person who is ill, this is particularly important. It teaches them to view the day not through the prism of fears and failures, but through what was steady and supportive. For you, it is a moment of release from pressure, closing the door on the day's stress. The last element is breathing meditation until the incense stick has burned out. Such a time marker is extremely calming. You do not have to watch the clock or count anything, you simply stay with the breath until the incense completes its cycle. This practice is fully in line with the old monastic tradition, meditating not for a set time, but for the symbol. For the person who is ill, this period is short enough not to provoke anxiety, and for the caregiver, long enough for the nervous system to reset. Research on meditation shows that it is precisely such short, regular practices that have the strongest stabilizing effect. The evening ritual works on several levels at once. It calms the body, orders the mind, stabilizes the relationship, and gives both of you a sense that the day has a beginning and an end. In the context of caring for someone with a mental disorder, it is one of the most effective tools for reducing stress. When the evening becomes a sacred, peaceful space, the whole family system starts to breathe more easily. And the more stable the evenings become, the more stable everyday life becomes. Summary: stress reduction works best when it includes the environment, pharmacology, and inner practices at the same time. None of these methods is complete on its own. Only their combination creates a stability that allows both the person who is ill and you as the caregiver to function. The first pillar is the environment. Without an ordered space, clear boundaries, and your private resting zone, the other methods become far less effective. This is the foundation that protects your nervous system from constant overload. When the environment is calm, you gain the capacity to use other forms of support. The second pillar is pharmacology. This is not a substitute solution, but a tool that supports the nervous system when the overload is too great to cope with solely by non-pharmacological means. Anti-anxiety, sleep-regulating, and mood-stabilizing medications can restore a level of balance that brings back the ability to rest and think. They work best when you communicate your real level of strain to the doctor. The third pillar is inner practice, mindfulness, conscious breathing, reducing stimuli, the evening ritual, and short micro-tudongs. Each of these methods reduces tension on a different level: body, emotion, or relationship. Short, regular practices are more important here than long sessions done only occasionally. In practice, the caregiver's day has 3 stages. First, stabilization, organizing space, rest, and boundaries. Next, regulation, responding to stress when it appears, using breath, silence, or a walk. Finally, closing the day, ritual, conversation, and short meditation, which close the emotional load and lower arousal before sleep. Your well-being is a condition for effective care. If you burn out, the care system stops working. Stress reduction methods are there first and foremost to protect you, and only secondly to support the person who is ill. When you are in balance, both of you function more steadily. And that is why stress reduction is not an add-on to treatment, but its very foundation.